I was diagnosed with HIV in 1983, and it was at a time when there were no medications. So it was a scary time for a young man. I was 24 at the time. They just told me to get ready to die in 2 years. The early days of the epidemic were both paradoxically beautiful and really awful, because we sort of showed a strength we didn't know we had as a community. We came together, we fought for each other, to take care of each other, to ensure that we could keep our loved ones alive. But it was in the face of mass casualties. A lot of very unpleasant things that I would never wish on anyone. I've had the same doctor for 23 years. I trust him completely. We work together on my health care. I've been positive for such a long time that I took all those first drugs and built up resistances to them. So I have multi-drug resistant HIV. And as time has gone on, improvements in HIV care have dramatically changed. They've gotten much, much better. We worked together to find a combination that would control the virus. It didn't really increase my T cells very much, but at least it kept the virus to undetectable levels. The Medicare Part D drugs have been one of the reasons I've stayed alive. And without them, I would die. We cannot restrict those. Those have to be accessible. The protected classes are protected for a reason. They are important drugs that people need to take, and they thought enough of them to put them into a protected classes so there would be no questions asked. It wouldn't be about having to go through prior authorizations and step therapy to take your medications. It would be about access to health care. So it's really about seeing your doctor as a partnership. And when the government wants to come in and get in the center of that, that's not acceptable. Take action. Tell Congress to stop these proposed changes.